At the outset, I want to be clear with Canadians. The overall risk to the general population in connection with the Andes Hantavirus event remains low at this time. But given the severity of the symptoms of the virus, we are taking a precautionary approach to ensure that Canadians are protected. On May the 10th, 4 Canadian passengers on the MV Hondius returned to British Columbia. Throughout their journey and upon their arrival, public health precautions and health assessments took place. The individuals were transferred to dedicated prearranged lodgings to complete their self-isolation. All 4 remain asymptomatic and are being actively monitored and supported by local public health authorities. We have adapted the WHO guidance for public health management of contacts to the Canadian context and are sharing it and working on it alongside our provincial and territorial public health partners. While risk assessments conducted on the ship identified all Canadians as low risk, we have taken a precautionary approach here in Canada, and we are considering all passengers and crew from the MV Hondius to be high-risk contacts, as well as passengers who sat close to one of the cases with hantavirus who was on a flight, until local public health can complete their own risk assessments. In addition to the 4 passengers who returned on May 10th, there are 5 other high-risk contacts within Canada who are considered as having been potentially exposed to a confirmed case of Andes hantavirus. This includes 2 individuals who were aboard the ship but disembarked before the outbreak was first identified and who were also on a flight where they may have been potentially exposed to a confirmed case, and 3 other individuals who were potentially exposed to a confirmed Andes hantavirus case on a flight. These 5 individuals remain asymptomatic and are being monitored and supported by local public health authorities. So we were also notified of an additional 26 travelers who were on the flights but deemed by local European public health as being no risk. Again, in Canada, we are taking a precautionary approach, and we have deemed them to be minimal or low risk as opposed to no risk. The provinces and territories, therefore, are undertaking the work to contact these 26 individuals and provide them with information and monitor them throughout this time. As the situation continues to evolve, the number of individuals for public health follow-up in Canada related to the outbreak of Andes hantavirus may change over time, and our response will evolve accordingly. Provincial and local public health authorities continue to do in-depth risk assessments, and the final self-isolation duration may be adjusted as we learn more about the risks involved. I would also like to flag that we do not have any evidence that shows that the virus can spread from asymptomatic people, and so there is no reason for us to be concerned about contacts of contacts at this time. So our concern rests with individuals who were exposed to a confirmed or probable case of hantavirus, not those who were contacts of contacts to the virus. All of this has been discussed with my counterparts in the provinces and territories, and we are working hard to align our approaches and will continue active dialogue to support our collective response. Any contact who displays symptoms will be tested. FACT's National Microbiology Laboratory stands ready to provide testing and has been collaborating through the Canadian Public Health Laboratory Network to provide testing capacity and support to provinces. If cases are identified in Canada, FACT has already worked with provinces and territories to identify healthcare facilities that have the capability to manage hantavirus cases.